Buenos días, good
Good
morning, bon
morning.
dia.
Bon dia.
Bienvenidas y bienvenidos
Welcome to
al
the
webinar de la Semana
webinar
Mundial
for
de la
the
Lactancia
World
Materna con el
Week
tema La
of
lactancia materna para un
Breastfeeding,
comienzo
with the subject
sostenible
matter
en la vida,
breastfeeding for a
fortalecer
sustainable
lo que
start in
funciona.
life,
Welcome
strengthening what
everyone to
works.
the World Breastfeeding Week webinar organized by the Pan American Health Organization on the topic Breastfeeding for a Sustainable Start in Life. Strengthen what works. My name is Leslie Bejar. I'm Technical Officer in Malnutrition and Food Systems at the Unit of Risk Factors and Nutrition in the Department of Non-Communicable Diseases and Mental Health at the Regional Office of the Pan American Health Organization. And it's a pleasure for me to join with you as your facilitator and moderator in this webinar. Un poco de recomendaciones para este webinar. Este webinar se
Commendations
llevará
for
a
this
cabo
webinar.
en inglés y en
This will
español
occur
y
in
cuenta
English and
con la
Spanish, and
interpretación
we have
simultánea. Para
simultaneous
esto les pedimos
interpretation.
que hagan
For
clic en
this,
el
we
icono de
ask you to
globo
click
que
on the
encuentran
globe
con el
icon. You
título
can
de
see it
interpretación
in the lower
que
right.
encuentran en la
It says
barra de herramientas
interpretation. You
de
can find
Zoom.
it in the
Por
toolbar,
favor,
the Zoom
seleccionen
toolbar.
el
Please
idioma de su
select the
preferencia
language that you
y si
prefer.
desean escuchar
And if you
únicamente el
wish to
idioma
listen only
interpretado,
to the
activen la
interpreted
opción de
language,
silenciar el
activate
audio
mute
original.
original audio.
The webinar will be held in English and Spanish with simultaneous translation. So translation is available by clicking on the globe icon in your Zoom toolbar at the bottom of your screen. You may have to click more options to find the globe. Please select the preferred language and to hear only the interpreted audio, turn on the option of mute original audio. And for all the participants, you are more than welcome to put on the chat where are you joining from and what country are you joining for. So without further ado, I would like to introduce Vanessa Garcia Larsen, who is the Chief of the Risk Factors and Nutrition Unit at the Department of the Non-Communicable Diseases and Mental Health at the Regional Office of the Pan American Health Organization, so she can give us the welcome and opening remarks. Over to you, Vanessa.
Thank you, Leslie. Hello, everyone. Good morning, good afternoon, and thank you for joining us today. On behalf of the Pan American Health Organization, it's my absolute pleasure to welcome you all to join us for the World Breastfeeding Week 2026 webinar, Breastfeeding for a Sustainable Start in Life, Strengthen What Works. World Breastfeeding Week is an important opportunity to reaffirm our collective commitment to protecting, promoting, and supporting breastfeeding as a cornerstone of public health, nutrition, and sustainable development. This year's theme challenges not to only advocate for breastfeeding, but also to examine what has proven to work, measures of progress, learn from success, and to accelerate action. Breastfeeding remains one of the most effective interventions for improving child survival, nutrition, growth, and development. It provides infants with optimal nutrition, protects against infectious diseases, supports healthy development throughout the life course, and continues to contribute in a very meaningful way to the prevention of overweight and obesity. Mothers can also benefit through improved health outcomes, including reduced risk of breast and ovarian cancers and type 2 diabetes. Despite the well-established benefits, breastfeeding rates across many countries in Latin America and the Caribbean remain below recommended levels. So much so that less than half of infants under 6 months of age are exclusively breastfed, and many children are not breastfed for as long as recommended. These gaps contribute to the region's ongoing triple burden of malnutrition and highlight the urgent need for stronger and more coordinated action. At the same time, there is reason for optimism. Several countries in our region have demonstrated that progress is indeed achievable. Their experiences show that improvements in breastfeeding do not result from a single intervention, but rather from sustained investments across multiple sectors. Strong legislation aligned with the International Code of Marketing of Breast Milk Substitutes, implementation of the Baby-Friendly Hospital Initiative, community support systems, workplace breastfeeding protection, skilled counseling, and human milk banking networks have all contributed in an extremely meaningful way and generating lasting gains. So today we're going to hear examples from countries such as Bolivia, Peru, and Uruguay, whose experiences demonstrate the importance of building comprehensive systems of support for breastfeeding. Their successes remind us that when governments, health systems, communities, workplaces, and most important of all, families work together, breastfeeding can actually thrive and children are given a much healthier start in life. Every mother deserves continuous support for pregnancy throughout childbirth and throughout the breastfeeding journey. Strengthening support is essential if the countries of the region are to achieve our regional and global breastfeeding targets and contribute to broader goals of food and nutrition security, poverty reduction, gender equity, and sustainable development. So I encourage all participants today to use this discussion, the discussions we are going to have, as an opportunity to learn and share and to identify practical actions that can be adapted and scaled within your own settings. By understanding what works and why it works, we can actually strengthen policies, programs, and partnerships that support breastfeeding across the region. So thank you again, everyone, for joining us today, and I wish you a very productive and inspiring webinar. Thank you.
Thank you very much, Vanessa, for your kind words. And now we're going to move to the first presentation, and I would like to introduce my colleague, Dr. Audrey Morris. She's an advisor on food and nutrition at the Department of Non-Communicable Diseases and Mental Health in PAHO. And she's going to be presenting Strengthening Breastfeeding, What Works. Over to you, Audrey.
Okay, thank you so very much, Leslie. And it's my pleasure to do this presentation this morning to let us learn a little bit more about what has been proven to work in strengthening breastfeeding. Why does this matter? We know the benefits of breastfeeding is a high impact intervention for child survival, for maternal health, and sustainable development. It protects infants from diarrheal disease, respiratory infection, and life-threatening illnesses. Breastfeeding supports growth, cognitive development, and the risk of overweight, obesity, and diabetes. It benefits mothers also by reducing the risk of type 2 diabetes and breast or ovarian cancer. And overall, it contributes to the Sustainable Development Goals, the SDGs, for health, but also for nutrition, education, gender equality, decent work, and sustainable consumption. Globally, exclusive breastfeeding reached very close to the 50% target that was set for 2025. At the end of 2025, the breastfeeding rate globally was 48%. And thus the target has increased now to 60%. At least 60% of babies 0 to 5 months should be exclusively breastfeeding, and that's a target for 2030. A recently released study showed that a package of health system support for breastfeeding, including counseling and implementation of the 10 steps to successful breastfeeding, would generate returns of up to $59 for every dollar invested. So, globally, what has happened between 2017 and 2024 is that 75 of 106 countries with updated data have been able to increase their rates of exclusive breastfeeding. However, there are declines in some countries, and this underscores the need for everyone to work together for stronger policy implementation, monitoring, and targeted support. Let's look at what has happened in the PAHO region. The Americas estimate is overall 37%, but as you can see, there's a very wide variation in exclusive breastfeeding rates, ranging from 3.5% up to 70.1% in Peru, also higher rates in Uruguay, Guatemala, and Bolivia. So these countries were able to surpass that 50% global target that I mentioned. However, while they have been able to do so, many countries in America, the American region, lag behind. Here you can also see the rates of early initiation of breastfeeding between of infants. This data was collected from about infants 0 to 23 months who had early initiation of breastfeeding. And as you can see also, there is quite a disparity in the rates throughout the countries. So what are the interventions that work that we should be looking at in implementing in all the countries of the region? The first one is providing skilled counseling on breastfeeding and infant and young child feeding. So this support is necessary during antenatal care and throughout the first 2 years of life. Sustained skilled counseling during pregnancy, at birth and discharge, during postnatal and community visits, and during the complementary feeding transition. So WHO recommends that every mother should receive breastfeeding counseling on at least 6 occasions. The counseling should be practical, respectful, and oriented towards problem solving, addressing positioning, milk transfer, and the mother's confidence, building her confidence, and also counseling her about responsive feeding. Pre-service education and continuing professional development of those persons who are doing the counseling. Those aspects are essential for consistent quality. And also, there's a need to scale up the community programs for breastfeeding support and peer-to-peer support. The second recommendation is for making quality care in maternity facilities the norm. And what does this mean? This means implementation of the 10 steps to successful breastfeeding as a standard of care. And the 10 steps to successful breastfeeding is implemented through the Baby-Friendly Hospital Initiative. In making quality care the norm, is necessary then to ensure early initiation of breastfeeding and avoid the practices that disrupt breastfeeding establishment. Equip maternity and newborn staff with the competencies to protect, promote, and support breastfeeding. Provide technical assistance and continuous quality assurance for breastfeeding care in facilities. And support breast milk provision for sick and vulnerable newborns. The third recommendation is promoting breastfeeding through national media campaigns. And there are a variety of ways and a combination of ways that this would be done through social media, being careful to have digital content and trusted voices that normalize breastfeeding. There's a lot of information out there that does not normalize breastfeeding. And in health programs, in breastfeeding programs, we need to counter a lot of the misinformation that is there. Another way of promoting breastfeeding is through local events. So health fairs and open houses, these provide opportunities for reaching families directly. Of course, there is the overall campaign with national messaging across the traditional media, television, radio, print, and even outdoor signs, and community activities. We keep coming back to this aspect of community activities, mother-to-mother support groups, and peer support in local networks. Protect families from inappropriate marketing. That is another intervention that works. Fully implement, monitor, and enforce the International Code of Marketing of Breast Milk Substitutes. So countries all need to adopt national legislation that is closely aligned with the code and the subsequent relevant World Health Assembly resolutions. That package, altogether known as the code, includes the WHA resolutions. The national legislation should cover all forms of promotion, including health facility, retail facilities, the shops, the pharmacies, sponsorship, and very importantly, the digital marketing environments. The legislation needs to also have an aspect of monitoring, free from conflict of interest, with sanctions strong enough to deter violations. And also there is a need to build public and professional awareness so families and health workers can recognize and report violations of the code. The sixth intervention is paid maternity leave for mothers, actually adopting the ILO, International Labor Organization, recommendations for maternity leave. So these recommendations and conventions are for paid maternity leave, which allows mothers to breastfeed. The mother does not need to have to choose between having an income and feeding her infant. And there is evidence that paid maternity leave can be associated with up to a 52% increase in exclusive breastfeeding. And this benefits mother, of course, it benefits the infant, but it also benefits the employers, it benefits the workplace through retention, increased productivity, increased morale, and loyalty to the company. And I'll just mention that the recommendations, the minimum maternity leave from ILO, that recommendation is for 18 weeks. And the preferred benchmark, though, would be for 26 weeks. And the sixth intervention, sixth and final, make work compatible with breastfeeding. Family-friendly workplaces that reduce the barriers after return to work. So breastfeeding spaces, breastfeeding breaks for mother to be able to either express milk or feed her infant if her infant is nearby, and flexible work arrangements. And there's research to back this as well. Workplace breastfeeding support policies and programs increase breastfeeding by 8%. As I mentioned before, there is a very new publication on the global investment case for improved breastfeeding. And that shows, as I said, that there are a package of programs that they recommend would generate returns of $59 for every dollar invested. And that would be a package containing counseling and the implementation of the BFHI, add mass media and code enforcement to that, and that would increase breastfeeding rates up to 72% from 70%. And then if you add the maternity protection and workplace policies, the projected exclusive breastfeeding rates would be up to 73%. So all that would be the combined package that I just spoke about, all 6 interventions. So to remind you of what those 6 are, providing skill counseling on breastfeeding and infant and young child feeding, making quality care in maternity facilities the norm, that's implementing the BFHI, protecting families from inappropriate marketing, so that's national legislation of the international code, then promoting breastfeeding through national media campaigns, having paid maternity leave for mothers, and making work compatible with breastfeeding. PAHO supports countries in protecting, promoting, and supporting breastfeeding across the region of the Americas. We work with countries to strengthen legislation and monitoring of the international code, to address digital marketing and the commercial influence that can undermine infant feeding decisions. We work with countries to promote breastfeeding through advocacy to build political commitment and public awareness, and positioning of breastfeeding as central to child survival, healthy growth, and lifelong NCD prevention. And in supporting mothers also, we provide technical cooperation for implementing of the BFHI, for counseling and improving maternity service that is offered. And finally, we encourage policies that enable breastfeeding in health facilities, communities, and workplaces. I'll just notify you that upcoming we have the launch or the opening of our online course, Baby Friendly Hospital Initiative, the BFHI for maternity staff. We will open that course soon. It is based on the WHO UNICEF course, which is well known, the 21-hour course. And we have the course available, soon to be opened in English, and we will then work on the Spanish version so that we can be available to all our. Finally, I invite you to visit the PAHO website for more information, and thank you for your attention to this presentation.
Thank you very much, Audrey, for that excellent presentation. I think you offer a clear and evidence-based picture on what is actually working to strengthen breastfeeding practices, and it gives us a solid foundation for the discussion that will follow this webinar. So thank you very much. And now I will ask my colleague, ahora voy a pedirle a mi colega Pablo Durán,
Now I'll ask my colleague, Pablo Duran. He is my regional counselor for perinatal health or the PAHO and WHO systems. Can you present us about an equitable start, the impact of milk banks on saving lives of preterm babies?
Muchas gracias. Buenos días. Buenas
Thank you
tardes.
so much. Good morning, good afternoon. We are now sharing this, so this important webinar, and truly it's great to be able to be part of this forum and to be able to get to know the experiences in the different regions of our different countries of our region. Thank you for your kind words. It's very important to be able to speak in these few minutes about what is going on. What is standing out in this presentation is an equitable start, the impact of human milk networks. So we are aware of the preterm birth, but we are also aware with regards to the challenges at a global level in our region, what these preterm births mean. Rounding out numbers, 1 out of every 10 newborns, they are born preterm. So, of course, on a global level, there are 122 being born preterm, and in these cases, the challenge to start, it is notable, but as we've seen in the earlier presentations, there's strategies and things learned to improve this, but preterm births, extreme preterm births, or late births, the challenges to this, to the maintaining breastfeeding, they are being harmed in several factors. A lot of the times they are connected to health conditions, to characteristics that are associated to this, but also many situations are connected to practices, to forms of institutional labor that a lot of time do not contribute to making it easier from a rights perspective to the access to human milk. So this is why the 2030 agenda, as was said, this contemplates indicators, goals that these exist in terms of reaching the promotion of a nutritional state that is adequate, but also promote healthy lives. So early breastfeeding or consumption of human milk specifically, and these preterm birth groups, it is a key challenge. So the global strategy for children and teenagers, this main goal is to survive, connected to reducing preventable deaths, but also to promote better living conditions, better quality of life, development, and specifically for preterm births. And much more reason, we know that consuming more milk is ideal for our preterm births.
The third objective is about seeing and making sure that the survival and to be able to prosper in health is able to be achieved. And at this moment, at birth, these are the health facilities, the environments where this is able to happen. The quality of care for newborns, for premature ill newborns, is sustained in two main pillars. First, the provision of care based on evidence with information that is sustainable throughout time. This is accompanied by the experience of care by the family. And it is important to be able to see these two aspects, the provision of care from the health facilities and the participation of families in this process. And then seeing here specifically the facilitation to facilitate access to feeding with human milk is a challenge both from the perspective of the mother as well as from the perspective of a newborn. Audrey Morris spoke very recently about the 10 steps for a successful breastfeeding process and also talked about the baby-friendly hospital initiative for small, sick, and preterm newborns. We have the evidence to be able to implement different spaces, but also we recognize that it is fundamental to continue having progress in the implementation of this specific strategy, the strategy of being able to establish in human milk banks. We do know that human milk coming from healthy donors is for newborns that are preterm and ill, and it's the preferred method of feeding and the option when women are not able to breastfeed their own children. Like we said, babies that require invasive interventions or that are in a more complex state of health. Many times they cannot receive the breast milk, but yes, they will be benefited from human milk from their mother or from the milk bank. Today, systematic reviews have demonstrated the importance of providing support from a professional aspect and also from families in order to be able to promote care and skin to skin contact throughout newborns that definitely need to be need to stay, for example, in ICU units. But this requires time, attention, and support to families, but also to be able to maintain and reinforce the institutional practices for this to be possible. Donor human milk must then be a strategy that is promoted and that is adhered to procedures and specific standards. Fortunately, as well, we do also have these standards and these procedures that are established and normalized in order for these to be constituted not only as an alternative that contributes to the health and the development of children and also support to women and families, but for this to be a sustainable, safe process based on ethical practices and in an appropriate clinical use, which is the attention provided to newborns. Of course, it requires planning, it requires resources, it requires systems that are responsive to needs, and of course, it requires the commitment of authorities, of management teams throughout health centers, which are fundamental for this to be possible. And from the perspective, with the commitment of promoting this strategy from PAHO to be able to show efficiency and to make sure that within a group of very important characteristics of vulnerability, it is that now, more than or close to 10 years ago, a center that is able to see here, as we previously mentioned, it basically responds the work plan that we are working with as a collaborative state, which is the National Institute of Women, Children, and Adolescents Health in Brazil, promotes and collaborates to be able to achieve the objectives of death from preventable causes, the prevention of non-communicable diseases, and to promote the dissemination of knowledge and the participation of families throughout this process of contributing for all newborns and all children to survive, prosper in institutional contexts in reference to what is said. This information is a photograph of the situation in the Americas between 2009 and 2017. We are currently in an updating moment, but you can see from the year 2009 to the year 2017, there has been a growth in the number of human milk banks in countries of the region and the Americas. And here we've also been able to have this even increase more. Right now, we are working in the updating of this information, but a very important number of countries in our region currently have variable numbers of human milk banks with a very established experience. And of course, we invite and we promote to have this strategy also be replicated in other institutions, other countries, to be able to contribute to the fact that feeding for newborns, preterm and ill newborns, is not only from an institutional perspective, not only from the perspective of milk production, as we said, with conditions of safety, of quality, but it is also the fact that mothers, providers, families, and caregivers are also able to participate of this process. Of course, mothers with the support of milk, but also families in a responsive care, because we know it has already been said that it is not only about a biological process, it's an integrated process of nutrition that is comprehensive and goes beyond the nutritional aspects, but also includes the involvement of families and of mothers, specifically speaking, which have a fundamental role together with the health centers and, of course, the authorities. Therefore, now highlighting again the main messages that we mentioned, the importance of the early beginning in the sustainability in breastfeeding is particularly a challenge in preterm ill small newborns, and it represents a priority in reference to survival, but also in reference to health in the course of life. The potential benefit of breastfeeding in human milk in any newborn, specifically in preterm and ill newborns, is fundamental, and this definitely requires the disposal of policies for planning, for training, and of advocacy, so that these aspects, specifically speaking, this technology of human milk banks, can contribute and allow the growth, the development, and to be able to prosper from newborns, from families, from communities, and from the countries of our region and other regions as well. Thank you very much. Thank you very much for this wonderful presentation, Pablo, which definitely also shows us with clarity the impact that human milk banks has when saving lives, both of preterm newborns, and as you mentioned at the end, especially the need of reinforcing these policies, planning, training, advocacy, and communication so that this is a reality. Now we're going to pass on to a panel where we would be talking about the way or the route to increase breastfeeding. In this panel, this will be in Spanish. It will be held in Spanish. So everyone, every participant that is here with us, you must remember that you need, well, if you want to hear in Spanish, please close the simultaneous interpretation.
That would like to hear the interpretation in English, this panel is going to be held in Spanish, so please turn on the interpretation in English. And you can mute the original audio if you want to hear only in English. Y bueno, para este panel,
And well, for this panel, just to comment that although the region has not been able to achieve the world goal of 2025, where 50% of babies from 0 to 5 months of age receive breastfeeding in an exclusive manner, there are countries in our region that have been able to achieve and even have exceeded this goal. And today we will be listening to 3 of these countries so that they can share with us regarding their policies, programs, and interventions, as well as some challenges they've had that have contributed to this achievement. So for this, we will have the participation of stories from 3 countries, Peru, Uruguay, and Bolivia. And I would first like to welcome Lourdes Lucia Ortega Vera, who is the Executive Director of the Direction of Interventions for Course of Life in Integrated Care from the General Direction of Interventions, Strategic Interventions in Public Health of Peru, so that she can present to us the path of breastfeeding, breastfeeding in Peru. Go ahead, Lourdes. Very good. Thank you. Thank you. Well, the path towards the increase of exclusive breastfeeding in Peru. Next slide, please. As you all know, my country is a country that has a geographic and cultural diversity. Evidently, each one of our populations have developed their own customs, and the state advocates to have interventions and activities that help the communities respecting their own diversity. Here in the coast, it is called when we talk about the quicha, and we have these kind of quilts that cover our children and they get them closer to skin contact. In the jungle, it's a collective breastfeeding where we have the mothers that produce more milk that support other women that can have accumulation of breast milk to be able to provide this breast milk to children. So it's three regions. Just in a very general manner, it would be three regions with the same goal, which is about guaranteeing the well-being of our children, respecting their customs and their roots. Okay, next one, please. Always considering that the objective is the same, right, in reference to the state. And the state has also implemented different general policies. Within these policies, we have the ninth guideline that is about health as a right for the well being of citizens. But this is not isolated at all. It is not that just one part is seen. We have another one, which is, for example, in reference to national dialogue that allows us to be able to have this done. And level five, for example, in which there is a promotion in reference to the departments where throughout different ministries and different sectors in the state, we are able to contribute in the well-being of citizens also in health. For example, in the supply and to be able to send to people the use and suitable water for consumption. And all of these interventions as a country are registered within our national policies for the correct approach. And in reference to being able to see this part here, we have the multi-sectorial health national policy in 2030, Peru, a healthy country where we have this as a priority in reference to being able to have the promotion of healthy habits and practices, the fight for chronic malnutrition and child anemia, and the multi-sectorial approach and labor environments. Here, it is important to see that there are different policies and guidelines of other sectors, such as the Ministry of Women and Population, Vulnerable Population, that have adequate spaces in the different health facilities or work facilities to be able to guarantee to women population that has entered to be an economically active population that is currently working, and for them to be able to have a suitable space for the suitable extraction with the health measures for this extraction. And then we also have our multi-annual sectorial strategic plan, where, as we mentioned in the previous slide, here we are able to establish some interventions and that contribute or manage certain specific social factors to be able to contribute in the guarantee of breast milk. And the institutional strategic plan from 2025 to 2030, where we're able to establish as a sector how we prioritize these components in reference to a healthy practice, and also in reference to being able to see these budget ends a reinforcement in reference to also infrastructure of sanitary support and support networks. All of this is done with the community participation. In the case of the integrated approach, the second point, we have commitments of improvement with different facilities nationwide. Next one, please. Yes, in reference to this intervention, it is not a recent intervention. As you can see, since last year, we have a timeline of the same way for the interventions as a country. We are considering, within all of this, the institutions or the hospitals, Friends of Children, from the year 1996, in which this intervention was delivered. Unfortunately, throughout the pandemic, we have found different interventions. We have found different interventions, and here we are now starting to promote this again. So it is throughout, in the case of Peru, with the certification of these different facilities. And you will be able to observe that we're also assisting or we're also working in guaranteeing this breastfeeding in the case of an intervention for preterm newborns throughout the National Committees of Human Milk Banks. And this has already been projected in 2025 for its regulation. Next one, please. In reference to this legal and complementary and in favor of working women, what happens throughout this process and definitely the attention of a newborn, the state has also seen, for example, the law that is provided here, which is Law 26644, that provides prenatal and postnatal time off with a complete time of 98 days, 49 days prenatally and 49 days postnatally. So here we're able to see that our objective line is the breastfeeding specifically throughout 6 months. This is a process that also needs to be seen because women that work are able to enjoy this benefit in the best way possible. In that time, we have this period that for many women represents approximately 25% of the economically active population and for them to be able to use this benefit. Another one is Law 27240, which establishes the time to be able to give permission for breastfeeding for of 1 hour at the beginning or at the end of the shift, and the work to be able to stay more time for breastfeeding until they are able to have 1 year of age. And then Law 29896, where we're allowing spaces for breastfeeding in institutions where working women, are able to go twice a day throughout their work shift to be able to pump their milk in a suitable environment. Okay, and we also have Supreme Decree 023/2021, which was established by the Ministry of Women and Vulnerable Populations, which is the conciliation and it actually reinforces the spaces, institutional breastfeeding spaces. In other words, these entities for the protection of breastfeeding, we have a multi-sectorial committee and for the promotion and protection of breastfeeding, where we were able to establish the regulation for child breastfeeding, which we call RAID in Peru, and it is multi-sectorial, and it has been establishing or it has been making the International Code of Commerce as their own. Therefore, here with this, we are able to reinforcing breastfeeding and to be able to control this all of these ends, considering that this is the update, the updating of this regulation was in 2016. And we definitely have a standard as well of a technical committee, institutional technical committee for the prevention and promotion, for the promotion of breastfeeding, where we're actually trying to see child health with the participation of different organizations, population, and communities. And what continues? In this following slide, please. The situation of maternal breastfeeding in the National Institute of Statistics and Informatics in our country. Here you're able to see the evolution of breastfeeding after a 6-month period, passing from 2019 and the 65%, from 65% to 2025 with a 71%. This is, of course, higher in the rural end. Here we see the different regions or departments in the country. And in the first countries that you're actually able to see has been clearly distinguished. This is one that have more coverage, which are highlands, areas highlands. And in the case of San Martin and Ucayali that we have here. And then we see here the areas that have less coverage are in the coast, such as Moquegua and Tumbes, or border areas with other countries. We have still some ways that we need to work here to be able to improve this. Next one, please. Within our interventions, it's not only about breastfeeding. We've made it a necessary and fundamental part for the immediate attention of newborns here in reference to being able to see the skin-to-skin contact throughout the first hour of life and breastfeeding in the first hour of life of the newborn. This is already included in the protocol. We have some standards from last year, and this is all being implemented and reinforced throughout our whole standards. This has definitely allowed us to be able to improve our historical growth, passing from 19.9% to a 75%, which is in reference to the immediate attention provided to newborns through breastfeeding. And finally, in reference to what has to do with the physiological, natural physiological ends for children. Next one. Within this is the ranking of the departments in our country. As you can see here, we are able to certify the health facilities that assist everyone. We don't have them categorized here as 1, 2, 1, 4, and 2, 1, the other one, other hospitals at a hospital level. And we have 1,143 health facilities according to the systems in different regions and departments that have been certified and approved throughout 2025 in this period of 2022 to 2025. And therefore, we continue working and promoting this. This is also about considering here within the policies or strategies that we have as a sector and the commitments of improvement. But it's also about seeing here this identifier of budget, which also takes us to the fact that our facilities are incentivated so we can actually meet with these protocols and to be able to meet certification that is also going to be seen here for the improvement of the service. Next one, please. Within the strategies and achievements in the protection of breastfeeding, we have the implementation of the groups of community support. I think we forgot about the first. Yeah, this is the second slide. Please, we can go back one. Please, this is the second one, the first one. No, that's the third one. Okay, well, just if you can go back to the previous slide, please. There is one slide before this that we don't have, which was a certification of health facilities, where here we are able to meet the 10 steps of successful breastfeeding. It is one of the criteria to be able to certify, where we also are able to meet everything in the regulations that have to do with the acquisition and the control of these to be able to promote breast milk, breastfeeding in reference to the regulation, of course, and also the implementation of institutional breastfeeding areas. This has allowed us the increase or the growth of facilities. Here to this date, 2025, with 143 health facilities. To the year 2025, maybe this is the year in which we have had more accreditation. Half of the facilities, 583 facilities, have been certified, and definitely this is also continuous work in reference to the facility in every area. Here until the year 2022, we definitely have used certain measures with the attention of all of the services after the pandemic. This has been an impact and it has had different repercussions as well. And here, just before we see this other point, which would be the implementation of community support groups. This is with the participation of the direction of that we are able to work together in reference to health promotion, where we're able to carry out promotion and promotion for and coordination for work and community, the training and technical assistance. This is still work that we are reinforcing and beginning certain processes of improvement to be able to identify these guidelines for them to be able to be this communication and nexus that is more homogeneous with our population or the mothers of our communities, the accompaniment of these guiding mothers, and also the monitoring or implementation of different health networks to different health facilities at a regional or department level. Currently, we have 30,000 community agents, and these community agents, although they are not all mothers, however, they are able to work and being able to identify this guiding mother to be able to begin the training processes and for them to be able to provide sustainable technical assistance. And the next one, please. Lourdes, please. Could you start closing? Apologies. Yes, yes, of course. Yes, we're about to finish. The next slide, which is the effective counseling throughout the prenatal assistance and also throughout the birth and after birth. All of this is included in the updating of standards, and we are providing these processes and not only in the facilities that have been certified as women and children, but also all of the facilities that are about to be in process. Next one. And this is what we were talking about in reference to the implementation of the milk banks. We have a reality that is important here also in neighbor countries or those that are participating in this meeting, that there is an increase of prematurity and preterm newborns. This gives us an alternative that we need to provide to these women so that throughout the implementation of milk banks, this is done. This is not mean that we're incentivizing, it is a need and we're acting upon that need. We don't have any hospitals. For example, the maternity of Lima and its child, San Bartolome, in the regional hospital of Del Carmen and Junín and Cusco have already certified all of these parts. And finally, the last slide. Well, the main difficulties in the promotion of breastfeeding, we have the violation to the regulation and untrue publicity, increase of births by C-section, prioritization of budget, high work informality, insufficient support networks, and insufficient institutional breastfeeding areas. All of this is a process, and I believe that we are actually given correct steps, and I think that we are going to be able to get to what we're aiming for. Thank you very much to the whole team at a national and regional level for the compliance of all of this. I think that would be it. Thank you. Thank you. If there's any other question.
Thank you so much, Lourdes, for your presentation. And I think it really stands out the importance, relevance of having a legal framework that is strong. And you can see everything very well. And the slide is not an isolated effort. It's not isolated effort. It's something that happens over a long time and its results speak for themselves. So congratulations, Peru. Thank you so much. before we move to the next presentation, just to remind you, it's very likely that we have, depending on time, we'll have a Q&A session for 3 panelists. So you can go ahead and put your questions in the box. If there is enough time, we may answer them. If not, you may be able to support us with your answers. So now we will move to the Uruguay presentation, which will tell us about breastfeeding in Uruguay, the strategies that have worked, and the current challenges. And for this, I pass the floor and welcome Carolina de Leon. She is the breastfeeding coordinator of the breastfeeding program, National Breastfeeding Program of Nutrition of the Ministry of Public Health. So go ahead, Carolina.
Hola, mucho gusto, muchas gracias por la
Hello, how are you?
invitación.
Thank you for
Voy a
calling me up. I will
tratar de
now
compartir la
try to
pantalla.
share the
Ahí
screen.
está bien.
Everything okay?
¿Me escuchan?
Yes.
¿Está bien?
We have not yet seen your screen. We can hear you, but we cannot yet see your
Tengo que
screen.
poner aquí
So
compartir.
I have to share the screen. Okay. Should be visible now.
¿Ahí está bien? ¿Sí?
Can you see me okay? Yes, now it looks great.
Perfecto. Bueno,
Perfect,
muchísimas gracias
perfect.
por la invitación.
Thank you so much for
Voy a
calling
tratar
me.
de ser como
And
ajustada
I will
con los tiempos que
try
se me
to
solicitaron.
fit
Me gustaría
into the
contarles un
time
poco
that
en
was
este caso
provided
de
for
las
me. I
estrategias
would
de
like to go
Uruguay,
into a lot of detail for
pero
Uruguay's
bueno, vamos a hacer un
strategies,
recorrido
but
por
we'll
los
go over
indicadores y por algunos
things.
comentarios
We'll
en
go over the
relación a lo que ha
indicators and
funcionado y
some
los desafíos que
comments
tenemos
with regards
actualmente
to
en
what
el
has
país.
worked and the current challenges for this country.
El
So
Uruguay es un país, como ustedes conocen, con
Uruguay, as you
3,5
well
millones de
know,
habitantes, que ha
has
sufrido
3.5
actualmente un
million inhabitants
descenso muy
currently,
significativo y
has a
estrepitoso de los
significant
nacimientos
drop
para
in births
encontrarse en el mismo número de
to find
nacimientos
itself
que
with the
tuvo en algún
same number of
momento
births
a
that
finales del
we
siglo
had
XIX.
at the end of the
Ha
19th
descendido
century.
significativamente el
It's
número de
dropped
nacimientos en Uruguay y eso es un
significantly.
paradigma
The number of
demográfico que
births
nos
has dropped in
interpela y que
Uruguay,
nos
and
coloca
this is a
en que si no podemos
demographic
trabajar con los
paradigm that
nacimientos y las
really
familias
really
desde que
challenges
nazcan niños
us,
en el
because if
país,
we can't work
bueno,
with the families in the country, well,
deberíamos como replantearnos todo el panorama.
we should
Para
replan the
colocar
whole
acá
idea.
algo que nos
So
preocupa mucho en
something that
Uruguay
concerns us greatly in
es la
Uruguay
situación de
is
la
the
lactancia al alta de las
situation
maternidades.
of
Hemos
breastfeeding
evaluado como de
during
forma
maternity.
preocupada porque Uruguay viene
So
con
this is
descensos,
very
como les
concerning
voy a mostrar
because
en la
we've had
siguiente
notable drops,
diapositiva,
as you will see in
los
the next
descensos en
slide,
las tasas de lactancia
the
exclusiva en menores
drops
de 6 meses.
in
Creemos
breastfeeding
que
rates in
esta
less than
situación
6 months
de la
infants, less than
alimentación
six
al
months
alta de
also.
las
We can see
maternidades
that
en el país es algo
breastfeeding in
que
the
nos
country is
preocupa y que
something that
explica
greatly
parte
concerns us.
de
And
los
that
fenómenos
this
vinculados
explains
al
part of the
descenso de las tasas
phenomena
de
which
lactancia
is connected to
exclusiva,
the
más allá que Uruguay
lower rate
todavía
of
no baja
exclusive
de
breastfeeding
la meta
rates,
propuesta por la
something that
OMS para
Uruguay does
el
not yet
año
drop
2025,
below the expected goal
pero
by the
vemos que
WHO
aquí
for 2025. But we can
en
see
el
that
sistema
here
informático perinatal de
in
Uruguay,
the
que tenemos reportes
in the
bastante
system where we
sólidos
have
hasta el
our
2023, en
reports up till
2024 tuvimos reportes
2023 and
con un poquito
2024,
de
we had
dificultades, pero el
reports with
sistema
a bit of
informático
difficulty,
perinatal
but
nos
the
arroja
perinatal
este indicador
system,
muy
information system,
sustantivo
gives
y es
us
para nosotros una
substantial
fortaleza de
indicators. And for
vigilancia
us, it's a point of
que nos
strength
permite introducir de
when
la
it comes to
manera más precoz
monitoring. This allows
posible
us to, as best
soluciones
as
o
possible,
explicar
apply
determinados
solutions
fenómenos
or
y
to explain sort of
problematizarlos.
phenomena
Vemos que
and
aquí
try
ustedes
to
ven que
solve
tuvimos
this.
un
You can see
descenso
that
de la
we
lactancia
had
exclusiva
a drop of
bastante
exclusive
significativo en los años
breastfeeding, which was
de
quite
inicio de la
significant
pandemia para cómo
during the
venía
start of the
Uruguay
pandemic
en
years.
años anteriores, ¿no? Donde las
Uruguay,
lactancias
compared to
exclusivas al alta
the
de las
prior years where
maternidades,
exclusive
de los
breastfeeding,
hospitales, era del
when
93%
mothers leave the
pasando a
hospital, was
94% y en el
93%,
2020
almost
tuvimos el
94%, and then
72% de los
2020
egresos
went to
con lactancia
72%
exclusiva y
for exclusive breastfeeding
consecuentemente un
rates.
aumento
And
de la
because of
alimentación
this,
con
an
lactancias
increase
mixtas, es
of
decir,
mixed
lactancia y
breastfeeding. So
fórmula comercial
breastfeeding
infantil
and
para los
the baby
lactantes al ingreso
formula.
de las maternidades.
So
Recuerden que en Uruguay las
when they leave
maternidades,
the
el
hospital, they leave the hospital. So you have to
99,9%
remember that
de los
99.9%
nacimientos son
of births
institucionalizados.
are
Nosotros
institutionalized.
tenemos un
We have a national integrated health system that from the Ministry of Health, it deals with the practices. So we have a very strong possibility of being able to regulate these practices, but it greatly concerns us. Mixed formula breastfeeding, because we consider that this is the kind of thing that will help us to understand why there is a reduction in exclusive breastfeeding during the first 6 months of life in our country. This phenomenon of understanding why babies in Uruguay are more prevalent with their use of commercial baby formula. It was analyzed with a team from the Republic with data from 2008 to 2010. And I was able to work with the researchers. About 2020, what we saw is that it was due to three factors. One of them is whether you were born in the public subsector. If you were born with C-sec, this is a predictive factor of the introduction of commercial baby formula in an early manner, and birth weight for children. This is why it's important, what Dr. Uren was talking about, lower weight preterm babies. Also, the introduction of formula that's being normalized for lactating mothers and babies that are born with more than 4 kilos of weight. There are some paradigms that these explanations would help us to understand how to better practices to adapt them to this reality. We can also see in the same manner that as the years went on after 2020, there was a slight improvement up to 77% of exclusive breastfeeding when raised in the hospital, but it's still above 20% in the first 48 hours of life when families go home with commercial baby formula already introduced into the equation. We can clearly see this being reflected. These are the rates of exclusive breastfeeding the first 6 months in the country from 1996 till today, and the reference be a global, as you saw, 48%, the yellow bar, the WHO goal into 2025, and the WHO goal for 2030. We can see here that in 2011, reaching 65% of exclusive breastfeeding rates, and then we can see these drops further on. I was talking to Leslie about this, with Leslie, that for our Infan, or friends at Infan, they also take a look at this data. So why did Uruguay drop in a few years from 65%, 57 to 51%? That's what I want to talk about here. You can see, because in 2023, national survey for childhood development and nutrition and health that Uruguay has, luckily, it's a very strong tool that we have. It measures this indicator. Why does it give us this number? 51% when once upon a time it reached 65%. We believe there's a lot of explanations, but as we said before, we think that it is due to a drop in exclusive breastfeeding in the first month of life. You can see that on the screen, how the prevalence of breastfeeding the first 9 months of life and the 6 month of life. What happens in our country? What happens is that we see that exclusive breastfeeding during the first month, they drop amazingly in 2019, 65%, almost 90. But exclusive breastfeeding on the 6 months of life, between the 5th and the 6 months of life, it's higher. So actually, it's not explained by the prior months, by the last months, but by the start. That's why, well, on the other hand, our country presents an increase in continuous breastfeeding rates. We can say that in Uruguay, almost 60% of children that are up to 2 years of age continue to breastfeed. This says a few things. You can see that breastfeeding is more prevalent up to 2 years of age. in lower income countries and higher income countries. But this means that Uruguay is having a behavior that is less prevalent breast rates of exclusive breastfeeding, but more long-lasting over time. So maybe it's important to go into the care accords and paternity and maternity leave accords to think about, well, in Uruguay, well, you are in the IoT, but hourly reductions, they improve. And formal work, people that breastfeed, they manage to get an hourly reduction from to part-time, 1 hour of time to use breastfeeding rooms or to breastfeed their children. But what's more difficult is to sustain exclusive breastfeeding. So in Uruguay, when we analyze what worked for us, when we had better exclusive breastfeeding numbers, well, good eating practices, good nutrition practices, these child-friendly hospitals, baby-friendly hospitals, and the first level of attention. But it was a goal that the Ministry of Health had put up as a goal. It was, well, a demand that there was no way to deny these practices and go through this assessment. You had to respond to this goal. And when this goal is removed from public policy, thinking about, oh, well, it was going to be sustained as a practice, practices become weaker. So, on the other hand, there are what big wins in the clinical history and the information system health workers that indicate that the formula, baby formula, okay, why is this commercial baby formula indicated for use and use a prescription questionnaire where if there is a justified cost for the use of this formula, well, should not really move forward with this registration and we'll be able to find a cost for this analysis. But on the other hand, to develop skills for healthcare workers, all the courses that were implemented in 2018, we managed to implement a course that we make available from the platforms of the Ministry of Health. If any other country wants to go over it, with the support of UNICEF, we've thought about 2 platforms to make the best practices course for breastfeeding parents for small children, but also a big concern maternity. We developed a course called Protection of Breastfeeding in Maternity and during the first month of life. It has had 2 editions and has supported about 1,000 healthcare workers. It's little, sure, Uruguay is a small country, but we have a lot to do still with this course because we can see that one of the issues is how we monitor breastfeeding with C-sections. So we are not monitoring adequately. So we had not monitored from the start the C-section birth. So
no solo en todos los nacimientos, sino en los nacimientos por cesárea. Por otro lado, la red de bancos de leche en Uruguay, hay 3 bancos de leche y hay una red que se va a restablecer actualmente porque se consolidó, se sacaron normativas, pero todavía está como un poquito debilitada y la queremos continuar. Igual, más allá de que se han hecho muchísimos esfuerzos y Uruguay se caracteriza por su impronta en este tema.
There have been many efforts made in Uruguay. However, considering the commitment that we've established here from the ministry, we want to reestablish this and give the whole value that this initiative actually has. And on the other hand, Uruguay has a law of breastfeeding spaces and rooms where in the past 5 years it was not promoted, but we still need to be able to have a better implementation of this. And what is most concerning for us, that I think we all agree on this, is the abusive marketing that there is, an undiscriminated marketing in the digital and on users of breastfeeding. We believe that practices are extremely subtle, and we've seen this in evidence, and therefore the knowledge that occurs in the maternities is starting to use formula. We need to work on this because this is having influences not only in the practices of families, in reference to what they consider for it to be a better product than human breast milk, but also considering that this is actually it's been introduced in reference to the belief in health professionals that it is important to be able to introduce this for some matter that we need to consider, because this is something that we also need to find solutions on. So just very quickly, it's the last slide. We believe that in Uruguay we need to be able to work on this for this reality. Two main issues in reference to the early beginning of breastfeeding in C-sections, and also the use of maternities throughout the whole trajectory of the care of children in the health system, and to regulate marketing in Uruguay. We can definitely say that it is inferior to what happens in Argentina, Brazil, Mexico, but we do know that in scale it is the same as prevalent and abusive and complex what is being generated in the human behaviors. It is very much sensible time of life, and we also need to equilibrate and balance out and focus on the childhood of girls and boys. We need to see breastfeeding as a part of the reproductive sex health of women that breastfeed and persons that breastfeed, because there are many phenomena in reference to being able to see this to uh, breast health that we need to be able to take extreme good care of, because possibly we are not allowing for them to be able to work in certain more sensitive aspects that are of our concern to be able to sustain the breastfeeds that we have in a sustainable manner. So I think that digital marketing is seen in reference to how gender, mental health, and here to be able to see the reliability on families, and to be able to share the cares in houses and households. Therefore, marketing, considering here, we believe this is very much important. And there, for example, Uruguay is in the minimum of protection measures. We need to be able to want to get to even more, because it's a small countries with more births as time passes, and we need to be able to support them with your help to be able to achieve better normatives of protection. So, yeah, this is what we had to be able to share, and of course, I'm here to help in reference to the South American actions that we need. Carolina, thank you very much for your presentation. I think it is extremely valuable, considering that you're able to share the fact that although you've gotten to the goals and you're still in the goal of breastfeeding, you're identifying that there are important challenges, that it is important to be able to see them, to study them, to document them, and to assist them. Therefore, we definitely thank you for your presentation, because I also believe, considering that there are many other countries that are not achieving this goal, and these have these challenges, and we need to see how we are able to work on these matters. When talking about marketing, that is so aggressive, like it was mentioned in the first presentation, there are many challenges that document this practice that is violating the international code for breastfeeding and maternal milk. Now we're going to pass on to our third country. We know that there are some questions in the Q&A that we are going to take some time afterwards, but I will please ask Paula de Riva, that is responsible of breastfeeding from the Ministry of Health and Sports of Bolivia, to please present to us the situation of breastfeeding in Bolivia, the key findings of the Survey of Demography and Health of 2023, the historical advances, progress, and challenges. Go ahead, Paula. Welcome. Good morning to everyone here today. It is important to us, for us to be able to talk about this pillar, which is fundamental regarding food safety in reference to such a vulnerable group. And here in our country, of course, it is also important to be able to show the results that we've evidenced throughout the history of health of the year 2023. Passing on to the following slide, please. Thank you very much. Well, within this slide, we're able to see the golden hour. This is the first hour of life, which is fundamental for us as a country, and also considering in the following column that we see that this has to do a lot with the mortality, neonatal mortality. It has been an epidemiological impact that has been able to be reduced when talking about the mortality of children passing from 15 per 1,000 born alive to 6 per 1,000 born alive. And therefore, this is definitely a fundamental victory for our country, considering that this is not only a statistic achievement, but it represents many lives in our children. And this can definitely be due to the fact that there is a large amount of support in reference to the health facilities, especially with the immediate attention of this, and also to be able to establish also contact, skin to skin contact, and how we were showing here in the graph also we see here in the data reported by let's of 55 to 83.7% regarding the beginning of breastfeeding in children. Therefore, in this first slide, we would have a good victory at a central level, and also from the nutritional end, we will identify that it is very important for our children, considering that throughout this first breastfeeding, you will be receiving the important vaccine, which we already know for the colostrum. Next slide, please. In this other slide, we were able to see that there is a second victory, which for us is the exclusive maternal breastfeeding, considering that this has shown us a historic indicator in our country with a data of 84% from exclusive maternal breastfeeding in children under 6 months of age. And here we're also able to see the collapse in the use of breastfeeding milk to 2.4%. This could be due to the fact that many houses and economic resources are limited and the prices of this are quite elevated. Therefore, this positions Bolivia as one of the leaders in reference to exclusive maternal breastfeeding with these data established with this last survey. Okay, and as you have also been able to see, there is a very high increase, around 25.2%, that is also seen reflected due to the whole public policy that we have in the country, considering this is part of Law 3460 to be able to promote breastfeeding milk, and also the Supreme Decree that has also been able to see 0.15, and what we are going to be able to show later on. Passing on to the following slide, please. Thank you very much. We have shown data regarding exclusive maternal milk and immediate maternal milk breastfeeding. We have a very concerning challenge as Bolivia, which is the preterm or early interruption of this breastfeeding. Estimated colleagues, this slide that you're able to observe here is the counterpart that we have in reference to the data that have also been reported by ETSA, considering that this is a very important challenge in public health currently. And these challenges that have been already mentioned are seen maybe quite frustrating for us, given that this also reveals a premature or preterm interruption that is very much concerning for breastfeeding, considering that the average of duration of breastfeeding has drastically been reduced in 2023. Practically, there has been the loss of 5 months. Given that in the year 2016, there was a report of an average of 17 months of duration, in 2023, it has decreased to 12.1 months. Considering that throughout almost 5 months that have been lost, it is not only the loss of breastfeeding, but we're also talking about an immunological, nutritional, effective protection that these children lose and these Bolivian children use. And here we're also considering this. This is quite alarming data for us that around half of our children, talking about 46.5% of children between 12 and 23 months of age, have already stopped breastfeeding. we consider that the international entities, the WHO and UNICEF, recommend to keep breastfeeding to children over 2 years of age, which is quite a limit for us. And we've also evidenced that this could be due to the fact that although this is accompanied by complementary feeding, we also have many households that can be seen displacing this breastfeeding due to the introduction of these complementary feeding. And it could also be due to the fact that many of them go back to their work areas and start exposing children to be able to have different pathologies or some risks of malnutrition by excess. Can you please go to the following one? Thank you very much. In this slide, we can evidence that there is a territorial fracture here, considering that there could be the observation. These are what we have here in Bolivia in some of these departments, and we have some recommendations of the WHO. However, there are still other departments that at least have a little bit of more months in reference to the extended breastfeeding considered here in reference to Potosi to at least get to 14 months. And we evidence to be able to see different areas, considering this will not even get to a year because it's a very high concern for our country. Next one, please. Well, within these strategies that we are seeing here as a national level, we have the following. The first one is to be able to see the compliance of law number 3460, which is promotion of maternal breastfeeding and commercialization of its regulation. The second one is the initiatives of Friends of Mother and Children that we work on a first, second, and third level. The fourth strategy are the implementation of the friendly rooms for maternal breastfeeding in workspaces and study spaces. And finally, it is the implementation of the human milk banks. Passing on to the following slide, please. One moment, please. Sorry. Okay, and while we are passing on to the following slide, I think yeah. Sorry if it froze. No worries. I'll start explaining a little bit in reference to the that we have here, but as a first point, we were also talking about the compliance to standards. We were talking about Law 3460, that for us is a fundamental pillar. And in reference to Bolivia, thank you. Thank you. Perfect. Okay. Very good. Thank you very much. This is a fundamental pillar for us because it is based on the dissemination of the law. That's also been important for us. And that's why Bolivia, we extend this and not only to the commemorative week, but also for the whole month. And we are also displaced in this in reference to Supreme Decree. And we also have a specific regulation of infractions and sanctions. And consequently speaking to this in reference to all of the standards, we have different technical documents approved by the Ministry of Health, and sports being one of this, the initiative of hospitals seeing for women and children, and we have the initiative for the first levels of attention, and we have the specific regulation for the formation of committees of breastfeeding. We have the guide of the implementation of rooms for breastfeeding, and also here we have facilitator guides.
Next slide, please. Well, within these standards, we base ourselves a lot on the municipal level because we requested already these implementations at a municipal level, registering that in the 2025 term,
sean de acuerdo a la normativa que tenemos en lactancia. Adicional a esta, nosotros desde el nivel central presidimos el Comité Nacional de Lactancia Materna, que está conformado por diferentes, es multisectorial y tenemos diferentes actores que apoyan, ¿no?, a fomentar la lactancia materna. A partir de este comité, nosotros formamos comités departamentales y municipales que fomentan la lactancia materna y así también se llega a se llega a sancionar el incumplimiento de la normativa, ¿no?, a través de los servicios departamentales de salud y muy pronto desde el nivel municipal. Siguiente diapositiva, por favor. Gracias. Dentro de la iniciativa Amigos de la Madre y la Niñez, este es un recorrido que hemos tenido histórico. Si bien en nuestro país ha iniciado desde 1991 al 95, solo se han implementado en este primer momento 14 establecimientos, ¿no?,
We've been able
hospitalarios.
to have the implementation of 14 facilities, 14 hospitals, and as of the approval of the regulation of breastfeeding and maternal milk in Bolivia, we began using this initiative not only in reference to this level of hospitals or of second levels, but it's also from the first level of assistance from the year 2013 until this date, considering that it is from the first level of assistance where mothers start going to prenatal controls, and from this time we begin to be able to work on the supports and accompaniment to these mothers. Thank you very much. Yes, next one, please. And while this is a small summary to this date, in reference to being able to, we have 691 accreditations, and we are also working with reaccreditations to health facilities, and we have 114 reaccreditations nationwide, considering in reference to being able to see that there are some areas that have more accreditations. We have Oruro, Potosí, and Chuquisaca as well. And following to the next one, please.
Could you help us by finishing the presentation so we can move to the closing remarks? Well, as one of the last strategies, you can see the implementation of the breastfeeding friendly rooms. So we have 154 rooms. Next slide, please. As well as the milk networks. We have a milk bank here in La Paz, but we also started the infrastructure of another milk bank in the city of Uchicaba. And we move to the last slide. I believe it's the last slide.
Bueno, nosotros también identificamos que hay una
Well,
hoja de ruta estratégica para continuar
we identified that there is a roadmap to move forward, guaranteeing these first 1,000 days, which are so important for childhood. For us, the roadmap demands not just these feats we've had at a national level. It's very important, and it's a very important task at a national level also to promote research, promote support that we can count on and protect these 1,000 days for newborns, and so that we can guarantee the cognitive development, prevent chronic malnutrition, and that these kids are the future of the country. So thank you so much to all of you for listening to us. So thank you very much. Well, thank you so much, Paula. It really is inspirational for us to listen to the successful experiences that you shared from Peru, Uruguay, and Bolivia. We are very thankful seeing the amount of colleagues that have gotten together, not just from the Americas. We also see colleagues, professionals, health professionals from Europe, Africa, Asia, India. So thank you so much to all of you. I will finish this session thanking your contributions that you've had. One of the most important messages are the success stories about how you've managed to increase the rate of implementation of recommendations for exclusive breastfeeding. This allows us to get closer to our targets, the global targets. So this is a very important result from this dialogue. You can see how the policies and legislation that are giving a structure to these activities have a very important role to guarantee that interventions work. We also know that it is important to invest in breastfeeding and to guarantee that countries may have a budget for this. So the interventions that we're going to hear about today, they are cost effective and they include adequate support of health systems and also counseling at a community level. They can have great results. So with these positive messages, we finish today's session and we thank you all. We thank the entire technical team from the Pan American Health Organization that has made this session easier, everyone that has presented their experiences as a country, and of course, our colleagues that heard us all. Thank you so much, and see you next time.